Hey guys, this is Tyler, and welcome back to another reaction. All right, today we have a Reddit podcast, and it is Doctors, what was your dumbest patient experience ever? I've read things like this before. Where you run into some very, very dumb people when you're in the medical field. People who think they know what they're doing and everything just because they don't want to pay their doctor bills, which are expensive. And even in free healthcare areas, the healthcare system can be bullshit. Like, I've read a story one time where a guy's collarbone broke, and apparently in somewhere like Norway or whatever, they pay people to make sure they don't spend money on any unnecessary expenses. And they made a man spend weeks with a broken collarbone to see if a sling would fix it. And when it finally done, the man was fucking pissed with the woman that was in front of him, trying to tell him, he didn't need surgery. He needed fucking surgery. But you also get it on the other end of the spectrum. I got some Death Wish coffee, and it is very good. I remember another story where a woman couldn't get her baby to breastfeed. So the doctors told her, eat some oatmeal. But then when the woman came back, she was morbidly obese. And they're trying to figure out why, what's going on. They're asking her questions. They can't figure out why. But then the head man came in and asked her what brand she was eating. And apparently she thought that eating a bowl of oatmeal every day meant eating a bowl of oatmeal cookies every day. And she was fucking embarrassed. She didn't know oats were an actual thing. She thought oatmeal was just what oatmeal cookies were made of. And didn't know that just liquefied oats was a thing. Oh my god. But hey, at least the baby started breastfeeding. But in any case, let's read some dumb stuff.
Doctors of Reddit. What was your dumbest r/I am very smart patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No! No water! He's allergic to water!" Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy.
They're made with water.
The wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this stuff up.
Okay, every drink has water in it to some degree. There's no such thing as a water allergy. Don't quote me on that. I'm looking it up. Oh boy. Let's see. Get on my phone here. Can people be allergic to water? There we are. Okay. Apparently, yes, people can be allergic to water. It's extremely rare. It's called aquagenic urticaria. And contact water triggers an allergic reaction, causing itchy hives and swelling on the skin. Essentially, a water allergy where even sweat and tears cause a reaction. So yeah, sweet tea and Sprite could also cause an allergic reaction. Especially the sweet tea. Tea's mostly water. Just water boiled with tea leaves. Ugh. So you're not allergic to water, you jackass? Oh boy, you know what? I got coffee with it, but I'm gonna have some soda water right now. Juicy peach flavored. I know a lot of people are going to be like, hey, you're supposed to drink regular water with coffee. I'll get some later. Right now, I just want some stuff with some flavor in it. All right. But also, 10 members of the family are not going to be able to fit in one room, especially with another guy that's 400 fucking pounds. You know, I thought I was fat. I'm like 230. Ugh. Come on, man. Ain't no way you're going to fit in that.
Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she says she drinks a 32-ounce soda every day. I ask her if it's regular or diet, and she replies with, it's half regular. I let the ice melt first so there isn't as much sugar in it. Sorry, but that isn't how it works. I had to...
No. That is not how it works. Oh, God. Itchy. How the hell are you going to think that water is going to dilute the sugar? It's not. There's still the same amount of sugar in there as it was before. You're just letting the water... You're just watering down your drink. Just drink a diet soda. It's not that bad. Hell, I grew up on the damn shit. I am bad ADHD. But instead of getting me some medication, the idea was to take sugar completely out of my diet.
A patient who was a completely non-compliant diabetic, smoker, morbidly obese, who had his first heart attack at 45. His blood pressure was also super high. And instead of taking his anti-hypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time, and sweat a lot, and lower his blood pressure by becoming dehydrated. Amazing. I bet he wouldn't listen to a dang thing you said either, because it did technically lower his blood pressure. I have one.
Okay. Smoking is a one fucking habit that is very difficult to beat. Should know. Spoiler, I vape. Or at least I did. I haven't had any in days. I'm actually trying to quit. You sit in the sauna and you dehydrate yourself to lower your blood pressure. I bet it's probably cheaper than the pills, but you're gonna kill yourself, dude. Come on.
I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and the flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case.
Oh, hell yeah. One, that stuff doesn't work on lice. It's fleas and ticks, you idiots. Like, God, and then... let me make absolutely sure what 7 powder is. I've heard of it, but not exactly sure exactly what it is. Yeah, it's a pesticide. It's something that kills a variety of insects that can harm plants and gardens. You wanted to use that for lice? And we already know how bad insecticides and shit are bad for the environment, and you're gonna fucking spray that on your kid? You're lucky he's not dead, you motherfucking. There's a word I want to say, but I'm not going to say it because it'd get me canceled. You're fucking morons.
70-year-old female tripped and fell 2 days ago. She came in with hip pain, but reports after the fall her nose was bleeding. She had
Okay. Good so far.
On her nose.
Well,
about a year prior, her dentist had messed up an infraorbital nerve block and caused some swelling in that region, but that was all resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative, "No, you are wrong. Just stop it. This has got to be the medical equivalent to, the update you installed on the computer a year ago is making it run funny. Get over here and fix it. I work for an optometrist.
Yeah, guys. If you have not went to school or done any homework, any actual fucking homework in the medical field, stop acting like you know every fucking thing and listen to your doctor. They're not always going to be right either, but they're the ones that are paid to know what the fuck they are doing. Especially when something as simple as a fucking nosebleed, and if it had been a year, it would have already been an infection. You already would have been to the hospital. You would have already had it checked out. It would not have waited for that fucking long.
And it was the month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a reasonable thing for any parent, even he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well-spoken and appeared fairly intelligent. Everything went as normal, the doctor examined the boy, and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him, and will definitely need glasses for school. For some reason, this caused a switch to flip in the mom, and she spazzed out on the doctor, saying that her son doesn't need glasses, and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out, and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion, and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently, the first semester midterm results were in, and her son failed them all because he couldn't see the board in his classes and needs glasses. Any variation of this.
Again, these people are paid to know what they're talking about. And plus, getting any kind of prescription to somebody who doesn't need it is unlawful, illegal. It can seriously get people in trouble. Even something as simple as glasses. In a case like that where it actually fucks people up, and it ends up fucking people up, they could easily get fucking sued. They're not gonna do it. Well, you're gonna have assholes and con artists wherever you fucking go. That's just a fact of life right there. But in any case, you could sue these people if they fuck your kid up by telling you the wrong shit. And also they could lose their licenses and their lives can be absolutely ruined. Most of these people are not gonna fucking do it.
This, which I get all the freaking time. Me. So how are things going with your diabetes? I don't have diabetes. Then why are you taking metformin and Victoza and whatever? I used to have diabetes. Then replaced diabetes with hypertension/antihypertensives, etc. Or when I ask them what medical diagnosis they have, and they say none while taking a ton of meds. Or when they misname a funny part, prostrate, tendon, uterus, to name a few. Do you take any medications? No. Are you supposed to take any medications? Yes. What for, and do you know what they are? No. Do you think this chest pain could be because of the heart attack I had a few years ago? Well, gee, mister, it sure probably could be.
Oh, I fucking bet. Okay, you need to know what you got, you need to take your medication, and you need to not be a dumbass. Please. Especially if you're... I get it, it's expensive. And a lot of people are just going to be like, hey, I don't want this because it's too expensive. It doesn't need to be, I'm fine. Got the medications and can afford them, take them. Take your meds. Don't be a dummy.
Not a doctor, but I'm a nurse who worked in the OR at a trauma center. Was doing surgery on a 19-year-old who tested positive for meth and cocaine, who was grilling the anesthesiologist about every drug we were going to use in surgery because he didn't like putting chemicals in his body. Gotta stick with that organic, fair trade, non-GMO cocaine. Most of my own stories.
you are taking meth and coke, and you're gonna go on to them about, oh, I don't want these chemicals in my fucking body. You are ruining your fucking body by being on these goddamn illegal substances. By fucking God. Oh, people do not make sense. People do not make sense. Why do people have to be like this?
Go along similar lines to, patient has chest pain driving a coachload of school children, thinks it's indigestion, swigs bottle of Gaviscon, later diagnosed with a huge heart attack. My favorite ever story comes from a colleague.
Okay.
The patient comes into A&E with abdominal pain. As part of the workup, he gets an abdominal x-ray which shows the problem as clear as day. The colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's Column, the statue in the center of Trafalgar Square, London. On showing as clear as day, the colleague has then proceeded to remove, from the patient's rectum, an 8-inch replica of Nelson's Column.
Statue of the Senator. Nelson's Column. Nelson's Column. Nelson's Column. Nelson's Column. Nelson's Column. Oh my God. Just because phallic shape does not make it phallic object. Oh. No. Just no.
The statue in the center of Trafalgar Square, London. On showing it to the patient, the response was, "Oh, that's Nelson. He lives up there." He lives up there?
He lives
You're just
up
walking
there?
around with that in your butt 24/7? I've got two stories that stick out in my mind. The first is the mother of a toddler who came into emergency. The kid had cruddy green/bloody stuff coming out of his left nostril, and a lot of redness and swelling of only the left side of his nose and the
He stuck
adjacent
something
cheek.
up his nose.
Mom was sure he caught a sinus infection and just wanted some antibiotics. Now, I know some kids like shoving whatever will fit into their body orifices, and that this was more than likely, given the one-sided nature of his condition. But Mom was insistent that he never puts things in his nose.
Oh,
It took some
bullshit.
convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big ol' button battery. It would have been burning his
Yeah.
nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it could do a similar thing to their esophagus. This is an emergency and needs to be dealt with ASAP. I actually sneezed after reading that. Patient had a hard
Oh,
time getting
Jesus
pregnant.
Christ.
Finally conceived but miscarried.
Oh,
Patient has
man,
a
I'm sorry to
DNC,
hear
so she
that.
can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment, but she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility.
Oh,
We call her in for a
no.
conversation about the hormone levels not going away. After talking together for what might be wrong, they are going to go home and think about further tests. She says, "I need to go. I have an appointment at the weight loss center for an HCG shot." Turns out that she is on the HCG diet. HCG is the pregnancy hormone, and this was after an hour of the doc saying, "We don't know why you had these constant high levels of HCG in your blood, and we are worried."
Okay, I've never heard about HCG until now. I mean, I'm not a woman, so I probably would have never needed to hear about it. But I can understand from just this that the woman is a complete moron. Yeah, you're on an HCG diet, which is the pregnancy hormone. But the whole point is that you don't get the fucking pregnancy hormone, so you get the goddamn surgery. Oh, you. Oh. Okay. And they were saying they couldn't, even if she didn't know what ACG actually was, they said they couldn't figure out why she had so much ACG in her diet, in her blood, which shouldn't fucking be there.
Patient inquiring about birth control was adamant she wanted an IED. Take cover! It's a boy! Had a young woman with recurring UTIs that began after a recent partner and with no STDs. Went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not KY jelly. The mix-up had literally been a joke on House.
It's amazing how common that is. I'm not a doctor, but I've read so many stories of people using food, the food jelly, jam, as fucking lubricant instead of KY jelly, which is something completely fucking different. It should be obvious, people.
It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh, I have two good ones that come to mind. Clinical pharmacist here, by the way, with one story in the ER and one in the pharmacy. ER physician told me this one. 16-year-old boy presented to the ER with an extremely swollen, discolored woohoo. Apparently, he had been using his mom's insulin needles to draw blood out of his arm and inject it into his own woohoo. He thought that adding blood would help increase his size. His woohoo was terribly infected and he was hospitalized for a week or so. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control.
Hold on, I'm trying to pause. Guys, to all my fellow men out there, the only way to increase your size is through surgery. There's no pill. There's no form of needle. There's no form of liquid. There is nothing other than surgery that can help increase your size. Quit being stupid. You're gonna do nothing but hurt yourself. Either financially, because the damn pills are nothing but a fucking scam, of course. And all these other ways, no. You're just going to hurt yourself.
File and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. I can't fault her for being proactive, but I will say that she's doing too much. I'm a chorisman, not a doctor.
Yeah.
But I once had a patient tell me that there was no credible research that smoking was bad for one's health. Okay. Optician here.
Yeah, you're a fucking moron.
Refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that puff machine gives you glaucoma, and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people have been diagnosed with a disease. Glaucoma doesn't have any outward symptoms before you start going blind. This idiot just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Also, puff isn't that bad, guys. Try contacts. Your eyes stop fighting back pretty quick. The puff is a lot better than the old machine. It just hit you on the eyeball with a little ball and a lever. I also have plenty of patients that don't understand family history. I interview patients directly, so we don't have any real paperwork, and too many people can't answer simple questions. Do you or any of your direct family members have diabetes? Yes. Yourself or your family? Alternatively, if yes to family members, they start listing their spouse's family or stepchildren, not how genetic disposition works. Or after getting no answers to diabetes, hypertension, glaucoma, thyroid problem, heart problems, etc., I ask if they take any medications. Yeah, atorvastatin, thyroidazine, metformin, and low-dose aspirin. Oh, so you have everything I asked about. Check. Want some more? Way too many people don't understand presbyopia. As you age, your lens hardens and can't focus up close anymore. Of course, when this is explained, I get a lot of people who believe they're way too young for bifocals. No, 60 is not too young for bifocals. Why doesn't the doctor have to wear bifocals? He does. He's wearing progressives. You don't see the line. Or after trying to get used to multifocal lenses for a few days, giving up and demanding we remake them as single vision, and then getting mad at me again when they can't read with them. I never needed bifocals before. Why can't you just make me regular glasses? Regular glasses always work just fine. Yeah, you used to be 20. Also, you came to see us because you can't read with your regular glasses. In the same vein, these same people complaining about their own insurance to me because progressives are expensive. A line bifocal is covered entirely. Progressives cost a lot. I can't have lines in my glasses like an old person. Then you want progressives. This easily triples the bill. Why are you so expensive? I need to be able to see. Yeah, you need a bifocal. You don't need a progressive, you want a progressive. Insurance pays for what you need, not want. I actually had a guy make me talk.
Okay, I had to stop that because I need to say something to avoid copyright. And two, this is, oh boy. For one, the fucking glaucoma thing. It's in your family history if you're getting it. It doesn't come from the damn puff machine. And people thinking, oh, this stuff gives you it. Oh, you're just scamming me. If they end up doing that, and I end up being the case, one, that they could get sued, and business would pivot. Well, no, pivot's not the right word. Plummet. That's the word. Y'all need to get it through y'all's damn heads. Not everyone is out there to get you. And I didn't know about that whole lens hardening thing, the natural lens on your eye. That it actually makes a lot of sense. And a lot more people should be told about that. And also bifocals. My dad was in his late 40s when he needed bifocals. So if their late 40s is not too young, then 60s is of course an age where you're gonna fucking need them.
Talk to his insurance agent about him needing medically necessary progressives. A progressive lens is never medically necessary.
No, if it just means the line isn't there, then of course it's not medically fucking necessary. If you're old, you're old. Stop trying to look young. Besides, most of the time you're only as old or as young as you feel. Age is just a number. As long as you take care of yourself, you can be fine. You can look younger. You can feel younger. You can do whatever you want. But eventually, age is going to catch up to you in one way or another. There's nothing wrong with it. It's nothing to be embarrassed about. Yeah, because I just turned 30. And I feel like I'm starting to feel my age on me. But in the end, it's all part of the mind. Stop being so embarrassed about something you can't control.
Stop being cheap and listen to what I say. I am not a salesman. I'm a medical professional. Stop acting like you know better than me. 80-plus-year-old patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that
no
her
idea
father
what
be
that
kept
is.
on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point, you kind of have to stop being polite and just tell patients and family members bluntly that you don't have time for this crap and what you recommend they can do and what they want, and just document everything. It happens a lot, but she sticks out. TLDR.
Fucking bad. Like, diets are fine and everything, but let's be real and say that your body needs a lot of nutrients that people feel like you can live without. Like, I've heard about people trying to go as long as they can without water. Have you never heard of fucking my mind was a fucking blank on it now. I know what it is, I just can't remember the fucking word for it. Heat exhaustion and what's the other one? You guys know what the fucking other one is. One where your body completely runs out of fucking water. Like, people, like, if you're going to use those kind of diets, at least take a fucking multivitamin to make sure you're getting everything. Like, for me, it's tough getting groceries right now as it is for everybody. So I make sure I buy some multivitamins just to make sure I'm getting everything. Because I don't want to at least catch scurvy of all things, because of the lack of vitamin C. So I make sure I buy a multivitamin, and I got some vitamin C packs just to make sure I get something. Ugh. Your body needs its nutrients.
Gross eyeball stories from eye doctor.
Ew.
I recently had a 30-year-old insulin-dependent male argue he knows when to take his sugar medicine. He had bilateral retinopathy and a severe vitreous heme in one eye, legally blind. Driving a car last eye check 8 years ago, lost glasses 2 years ago. Will need 4 more surgeries, including an inevitable cataract. I had a patient tell me they clean their contact lens with milk because it gets the acid off them. I had a patient ask me if it was okay to look briefly at the sun for short.
Okay. Milk. Clean your contacts. I've also heard of people using their fucking tongue. One, when it comes to acid and milk will reduce your stomach acid for a short period. Well, I don't know if that's what it actually does. All I know is it helps calm acid reflux for a little bit. And trust me, milk's been a lifesaver for me for a while now. But now I take omeprazole. Yeah. I know I keep looking away. I need to make sure my shit keeps recording, because I know this crap can go out at any time for any reason. And I don't want to lose the video. But, come on now. Your milk does nothing for your contacts other than it might get them covered in black bacteria. Like, there's literally make the liquid. Water is better than that. But
short periods of time to improve their eyes. I was amazed and kindly suggested they don't. Had a patient put eardrops in one eye, white part of eye, conjunctiva, scarred over entire cornea, and was left with no light perception. Asked me if he should have come in sooner. It had been 4 months. He needs a cornea transplant, which suck and take over a year to recover from. Patient with a retinal detachment told me to put more medicine in their glasses to see better. Macula was off, so they could barely count fingers 4 feet in front of their face. Had a patient wear contacts designed for 2-week daily wear, left in for 8 months. They literally grew into and became a part of the eye. It was repulsive. Had a patient with a 6-year-old translating. Basically, no clue besides eye hurts. Her hand covering her eye. I asked to see the problem. Her eye looked like a shriveled up grape. The optic nerve was holding onto a shriveled up, decayed eye loosely hanging in the orbit. She wanted glasses. Had a lady put jock itch in her eye to cure her suspected fungus. I asked her why she thought it was a fungal infection, and she just had an inkling. They are rare. Cataracts on a 58-year-old male working rooftops for 30 years with no sunglasses. Best corrected vision was count fingers 6 feet one eye, barely seeing better in other. First eye exam. Mad when told he needs surgery and should not drive a car. Had a patient tell me the benefits of using alcohol wipes to clean her privates. Out of the blue. I'm an eye doctor. Had a guy clean his contacts and shower with shampoo because he was convinced it was better. Raging red eye 2 weeks later.
Oh, yeah, fucking course.
Always fun to hear. Vinegar? Salt water? Spit is not cleaner than fresh solution, but please tell me more. Had a guy recently come in because wife made me. Tried with tweezers to remove metal from cornea. Didn't look pretty. I removed the remaining metal rust with the needle and spinning burr tip brush. Antibiotics Q2 hours. Told him to not do that again. Had a patient crush a pill up and put in eyes. It was an eye vitamin but taken by mouth. Her eyes were angry. I had a patient walk in one day with no glasses or contacts. Had full penetrating cornea transplant in both eyes 17 years ago. Last eye exam was 12 years ago. Swore he could see fine. Clearly a transplant graft rejection, one eye with no functional vision, and other was a gnarly looking good eye. I barely got him seeing with glasses on the one eye and can't drive. Uncontrolled diabetes too. Messy. Have had more than one patient argue with me about not seeing right. They either had 2 or more contacts in the eyes or none at all. When they try to remove a contact that is not there, it causes a painful abrasion. Multiple women using non-approved glues to glue on fake eyelashes. Leaks and burns in eyes. Just why?
Why?
Using fake contacts from the nail salon.
I wonder why.
Then it never ceases to amaze me when I hear, I just use the same solution until it turns brown or black. Every day. Had a patient using a homeopathic drop to cure itchy eyes. She had pubic lice living on her lashes and they lay eggs and bite. Repulsive. But still convinced the drops cause the lice? Here's a link to a Wikipedia article about crab louse. You pluck the offending lashes out and use a cream to kill the crap you can't see. Thank God that was only once. I have to convince a lot of people to not use hand sanitizer in their eyes. Way too many, actually. I had a patient not taking her herpetic eye drops just because she wanted to pray instead. Yes, herpes on eye. Luckily, I convinced her to do both medicine and pray. I could go on and on.
I bet you fucking could, buddy.
One patient in particular is a pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD.
Is dental army?
The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No, I need you to move your head right." "Hey doc, are these cavities being caused by the anaerobic pathology microbes?" "No, they're caused by you eating snacks all day and not brushing." I'm an OR nurse, and I had an oral surgery patient who had a self-reported history of 250 plus various surgical procedures, a list of 20-some allergies, tons of reported health issues, plus her preteen son supposedly had dozens of health issues as well. She refused to remove her glasses during induction, started screaming and crying about claustrophobia when we put the mask on her face. She also insisted on taking a stuffed animal to the OR. Anyway, getting to the point. She was having oral surgery because she told us, insisted, that the last time she went to the dentist, they told her not to brush her teeth for at least a year.
What?
So she hadn't brushed her teeth in like a year and a half. That one was for the books.
Okay. Some people lives, some people, their lives just suck. Especially when you live like a person who has glass bones and paper skin. And they just have a multitude of problems and are just a wreck. Like, living, you need to be in a bubble at that point, but yeah, it's expensive and yeah, it just sucks. But no dentist is going to tell you not to brush for a year. Either you misheard him or you had a fucking dream. My God.
Pediatric dental is a minefield for I am very smart material. But why does my child have 17 cavities? We don't drink soda or eat processed sugars. All we drink is organic juice and eat those real fruit gummies. Well, fruit has a lot of sugar in it, but the bottle says no sugar added. Right, there's no additional sugar added, but there's already a lot in there naturally. Oh, and we're an all-natural household, so we don't use fluoride toothpaste. And we don't floss because the material the floss is made out of is toxic. Oh, and a lot of times we don't brush their teeth before bed because we're too tired. My favorite excuse for not flossing their child's teeth is, "Do you know how hard it is to floss a kid's teeth?" I mean, I'm a pediatric dental hygienist, so yeah.
These organic nuts are going to be the end of us. You're supposed... natural sugar. Fruits and vegetables and meat. Food. Most food items have natural sugar in them. In fact, Sugar is actually what our blood cells feed off of to survive. In fact, I read somewhere, I don't know how true it is, don't quote me on this, but apparently there's even a study about removing sugar completely from someone's diet and seeing if it could help kill the tumors off faster than other cells would die. But yeah, you will literally choke all your entire body to death if you did not consume sugar at all. Like, and it's damn near impossible anyway, so. Yeah.
Where to start? Picture a middle-aged man. His index finger is 5 times the size of the rest of his fingers. It smells, it's leaking pus, there's necrotic tissue, basically one huge infected cancerous finger. He was a firm believer in not taking any sort of medication, including antibiotics or chemo. Died a few weeks later, but he did manage to tell us we were all idiots before he passed away. Patient was a young child who came in with an extremely high blood glucose level. Once she was stable, we did some teaching, and I kept her for a few days for observation. For some reason, every time I checked her, her levels would be extremely high although we were appropriately treating her. Turns out her family would bring her fast food for every meal and hide it in the side table. More teaching and resources were put into place. Had a mom in hysterics.
Yeah, when you're in the hospital, let them feed them. If this food's gonna be healthier, it's gonna be better. Fast food for every meal is just ridiculous. Now, I still eat fast food from time to time. But for every fucking meal, really?
Because she was convinced that her neighbors, friends, stepsons, teacher's dog has MRSA, so her baby was going to die. It took everything within me to not tell her that most of the hospital staff have MRSA. Just had some amazing people inform me with several scholarly documents that MRSA isn't as prevalent as once thought. It's only about 5% of hospital staff. Thank you, wonderful people. But it took...
Okay, back to Google. What is MRSA? Methicillin-resistant Staphylococcus aureus. Type of staph bacteria that's resistant to many antibiotics used to treat regular staph infections. It's a serious threat and a common cause of hospital-acquired infections. We treat it with alternate biotics like vancomycin, but some strains have developed resistance. Ooh, that sounds bad. Apparently not as common as they thought, according to this person.
3 hours for me to calm her down after I called infectious control, her pediatrician, gynecologist, and family doctor. Yes, I had to call all these people. Yes, they laughed at me. Yes, she was beside me the whole time, questioning their judgment. I love my job, but at times it makes me crazy.
I bet it does, especially when you gotta deal with stupid people who think they know every fucking thing.
ERRN here. Not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? I've heard of not sticking your woohoo in crazy, but that dude's boyfriend was sticking a lot more than woohoo in crazy.
He kept saying he. He kept saying he. He in his boyfriend. You're a fucking guy, you're not gonna get pregnant. No amount of surgery in the world either is gonna make it where you can get pregnant. And plus, that's not how it fucking works. There's artificial insemination, but it still goes to the same fucking place. And as a dude, you do not have that place. And if you surgically get that place, you do not have the right equipment. Oh, okay. Give me a second, I gotta go blow my nose.
Wow, that's phenomenal. As a psych doctor, we allow for stupidity, but man, that sounds extra special. So, if psych cleared him, that means they determined he wasn't delusional, which means they somehow figured out with a degree of certainty that he was just that stupid. As someone who has done ER mental health assessment in the past, I would love to have been there to hear the series of questions that led them to, yep, he's actually that stupid. When you subscribe, make sure to hit the bell to turn on notifications. Put the playlist on in the background to finish listening to all the stories, linked at the top of the description. And if you like Am I the Genius, give Am I the Jerk a shot, linked in the description too. Either way, thanks a lot for watching, and we'll see you guys next time.
Okay, that's nice. Ended on 2 ducks. Okay.
I think I just won my taxes.
Oh yeah?
I think you need to shut up. Okay. Did my fucking taxes. My taxes were bullshit. Okay. So, lots of fucking dumb people. Lots and lots of fucking dumb people. And you just need to trust your medical professionals. There are going to be a lot of con artists out there, but your best bet is just to listen to the people who are paid to know how to do their fucking job. Alright, so I hope you guys enjoyed this video. If you did, like, comment, subscribe, do whatever you want to do. This is Tyler, and I'll see you guys next time. Bye-bye!